Hi, Sabari. Welcome to Texila American University graduation event.
Thank you.
We have a few questions for you today in terms of your PhD in public health. So first, I would want to understand a bit in terms of your motivations and inspirations to do a program in public health in PhD.
Thank you very much. I'm from Cameroon, and I've had more than 15 years of hands-on implementation of clinical services in my country. And I thought that it was time for me to develop my career to reach a level where I'll be more of policy making based on scientific evidence.
Correct.
So based on that, I saw the need to go in for career development. And as a full-time professional, I needed an academic institution that will permit me to keep my job and achieve my career goal.
Right.
That is why I went in for
Texila. Okay, that was my next questions. Anyway, so what the essential research or public health systems improvement skills did you develop during this course?
Yeah. Just to add, I found Texila an institution that is practice-driven,
Right.
that is research-oriented, and that encourage critical thinking. And with that, I was able to carve out a research study, a research topic that enabled me to solve a problem in my local community.
Okay.
Yeah, so that's what I can say there.
Right. So, and in terms of the academic or the research experience, what had the greatest impact on your growth?
Okay, thank you very much. My research topic was on antiretroviral treatment adherence and treatment outcome among HIV-infected adults in a rural community in my country, Cameroon. And this study came in to respond to a local needs in my community. So findings from this study has really informed policymaking. It has informed programs in my community, and it has improved patient care in general. Also, I succeeded to publish a few articles from this work, and it has had many reads. And from that, I've had a lot of contacts from other journals for me to be a peer reviewer for their journals. And that has really helped to grow my career.
Wonderful. And in terms of the faculties and the supervisors, how did they support you in your journey, in your academic journey for this program?
Okay, thank you very much. We had several levels of support during our days at TAU. We had the student mentors that were our first line support. I must say that they were very responsive. We had timely feedback, and they were very ready to support us in time of need. We equally had the faculties that came in during our one-on-one session to help us resolve some complex issues during our study. They equally accompanied us through our research work. Thanks to all the supports, we're able to make it today.
Wonderful. Thank you so much for that. And how is this PhD strengthening your work? You have mentioned about, a couple of, how it's helping in your community and how that's building policy making. And how is this PhD strengthening your work on the HIV, CHASEC project?
Yeah. Thank you. I currently worked in a PEPFAR-supported HIV CHASEC project in the country. And before starting my course, I was a junior employee. And along the line, after enrollment and when I was close to the graduation, my organization found in me an improvement in my skill, and I got a promotion. So this PhD study has equipped me with analytical skills. It has equipped me with data analysis skills. There is advanced epidemiological skills, disease control skills, and other like. So today, as an integrated service delivery improvement specialist in my organization, I apply the knowledge gained from TAU in integrated program or project planning, integrated implementation, monitoring and evaluation, and that has helped to improve the output of my organization. And I think they are very happy with me.
Wonderful. Glad to hear it. Now, when it comes to this challenges, what were the challenges you were facing while doing your PhD, and how was basically Texila was able to help you to overcome those challenges?
Okay, thank you very much. Studying at TAU was not a bed of roses, as I can see, especially for working professionals like myself. I had to manage family, manage work, and manage academics. That was the first challenge. And thanks to the prompt support and persistent support from student mentor and faculties, we were able to organize work, organize family time, organize academic time to move on smoothly. That is one. Another challenge was meeting up with the tuition fees. Yeah, it's true, TAU is affordable, but it's not free. So, but thanks to their student ambassador program, where we could refer students and earn bonuses, I was able to support part of my tuition fee from this project. So I was able to refer a couple, I think 4 or 5 students, and the bonuses I got from that referral factually supported my fees. Yeah, thank you.
That's wonderful to hear. And in terms of the last question, like what message would you like to share with the future public health researchers?
Thank you. So I will tell the future public health researcher that academics is good, career development is good, but you need to go where you have exposure. I chose Texila because I wanted international exposure. I wanted to meet other colleagues, we brainstorm and we connect. And public health is connection. You can't build a nation alone. You need colleagues from all walks of lives, from all backgrounds. You brainstorm together and you come up with solutions to meet our health issues. So for the younger or aspiring colleagues, especially professional or working professionals like me who want to develop their career, I would say go in for an institution that can permit you work and attain your academic development. And one of such is TAU. I will also say that research should not only end at publication. Research should lead us to change of policy. Research should lead to transformation of life, and that is all about PhD study. Come up with a solution to meet the needs of your community, and everybody will be happy.